At 12 months, 6 of the children were still on the diet, and all of them had had a really dramatic effect. Of course, that's why they were still on the diet. Presumably, those that didn't have a dramatic effect had come off and found another treatment. And there is a group of dramatic early responders. In this study, 18 children were reported who became seizure-free within 2 weeks and maintained that seizure freedom for more than 6 months. So they found that a dramatic response was more likely in children with predominant seizure types other than complex partial seizures. And what that probably gets to is some of the early literature that I mentioned before that had suggested that the ketogenic diet is not as effective in focal seizures or partial seizures. We use it all the time for those children. I think it is effective, but there are certain types of children, certain types of epilepsy where it's probably more effective, and I'm going to touch on that. So there are some specific syndromes in which I think many of us have seen it for a while, and some literature is starting to come out to support the fact that certain syndromes are more likely to have a good response to the ketogenic diet. This is a report of 81 children with Dew's syndrome. The table shows, the first column of the table shows the treatments that were used. The top is a ketogenic diet, and 58% of the children with Dew's syndrome had an excellent response to the ketogenic diet. That was the best therapy when compared to steroids, ethosuximide, clonazepam, valproic acid, and nitrazepam. Likewise, in Dravet syndrome, I think many of us believe that the ketogenic diet is one of the best therapies for Dravet syndrome. In this report of 20 children treated with the ketogenic diet for Dravet syndrome, at 1-year follow-up, 2 of the children were seizure-free. This is a disabling epileptic encephalopathy in which really seizure freedom is a pretty rare thing, and that's what you're seeing here. More important, though, is that about 62% had had a really, really dramatic reduction in their seizures. Interestingly, the EEG also demonstrated a reduction in epileptiform discharges, and that's kind of interesting. We don't really know always whether improvements in EEG are necessarily relevant to how a child's epilepsy is going to go, but it's certainly never bad to see an improvement. Dr. Kossoff has reported and spoken about using the ketogenic diet for infantile spasms. In this type of epilepsy, we know that when young children present with infantile spasms, we should act as quickly as possible to get their seizures under control. And for that reason, most centers that treat children with epilepsy have very protocolized treatment of infantile spasms starting, and that the medications that we use for infantile spasms have serious side effects. We use steroids, and we also use a drug called vigabatrin that's known to have some irreversible eye side effects. So because of that, people have looked at using diet therapy, and Dr. Kossoff has been a leader in this field. In this study, they reported 13 children who had used the ketogenic diet for infantile spasms, and 62% were seizure-free within 1 month. The reason that's important is, first of all, these type of seizures can be quite refractory, so 62% seizure-free is quite good. But what's important for us to look at is that they were seizure-free within 1 month. Because we know that infantile spasms need to be stopped quickly, we need to know how to use the diet in that case. So if you try one drug and it doesn't work after a couple weeks, and then you move to the diet, how long should you give it before you go on to try another therapy? And so this data helps us to make those decisions. As far as implementing diet therapy, I wasn't going to talk about that, and I think Jennifer's talking a bit about that later in the day as well, so that'll be good. But I was going to tell you a little bit about how we do it at Sick Kids, just because I'm up here and that's where I work, and also direct you to 2 resources. One, of course, is Dr. Freeman and Kossoff's book, The Ketogenic Diet, which is a completely invaluable resource for anybody who has anything to do with the ketogenic diet. And the other is also an initiative spearheaded by Eric and the Charlie Foundation, which brought together a big group of us who use the ketogenic diet to come up with this consensus statement on how to, really kind of how to use the diet. And I think it's a useful tool for people who are trying to start the diet in their center. I think there are, I saw the copies of it back there on one table. Is it on your table? On the Nutritia table. For sure, safe and successful use of the diet requires a team. There is no question about that. And the team includes the medical team and the family. And our diet team at Sick Kids is made up of our dietitian, and neurologist. So our dietitian, Christiana, myself, and now also Jeff Kobayashi has joined our team. We have an advanced practice nurse, Maria Zach. We also have a registered nurse that works with us in clinic. And we have a social worker and, of course, the family. We've made some changes to how we implement the diet because we're facing long waiting lists. And so one of the things we're doing now is when a child is referred to start the diet, we invite them to attend one of our scheduled pre-clinic assessment information days. And the reason to do that is because some families are referred to just hear about the diet from us in clinic, and once they hear about it, they realize that this might not be the right time for them, or they might want more information, they might want to go back and talk to their referring doctor about it. And so we find that coming to one of these sessions gives them some of the information they need before they even get to that formal clinic appointment with us. And all the members of the team present at that information day just to give really more, just to improve the family's knowledge. The other thing we do is we give them a questionnaire to fill out, and that's something that, again, all members of our team designed. And it asks questions about the supports the family has, it asks questions about their finances and their insurance, so that we can help to plan for how we're going to help them to implement the diet. And it asks a lot of questions that Christiana has designed about what their child likes to eat. Then they do come to clinic, and when we see them in clinic, we talk to them about the diet, evaluate whether they're a good candidate for the diet, and often order some pre-diet investigations. This could include a video EEG to rule out whether they're a surgical candidate or not, and also to identify seizure frequency before we start the diet, and usually some blood tests. Kids are admitted at our institution to start the diet. Not all places admit to start the diet, but we do. There's some controversy with regards to whether one needs to fast before starting the ketogenic diet to encourage ketone formation. That's not something we do. It is something Dr. Kossoff does, so there you go, a little controversy. There's a variety of ways of doing it. Christiana does ask them to skip breakfast, though, and then come in, and they initiate the diet with shakes, and then transition to food over the next couple days. We then see the kids back. They're usually discharged Thursday or Friday, and we see them back in clinic at 1, 2, 3, 6, and then every 6 months follow-up, at which point we do monitoring with lab studies. And obviously by seeing us, we also, depending on the child, we do bone scans to look for bone loss, we do renal ultrasounds to look for kidney stones, and there was something else, but now I can't remember. And obviously between those clinic visits, there's a lot of phone consultation with the dietitian and the nursing staff and the family. We do ask families to monitor urine ketones at home, and we also teach them how to monitor blood sugars, although they don't usually have to monitor many blood sugars, but if a family calls in and the child's unwell, we want to know what their blood sugar is, and we obviously want to know their ketones. These are some of the lab studies that we perform and our routine lab tests. And all the children require supplementation. Everybody who's on a ketogenic diet requires a multivitamin. And then depending on the results of different lab tests, we really tailor their supplements to how the levels in their blood that we find. Once again, those are good resources. So really just to conclude, I would just obviously point out that diet therapies are effective at controlling seizures in children when other treatments can't. And this is a very, very powerful treatment that we have at our disposal, and I'm very pleased that we're able to be here today to discuss it and hear from others and my colleagues about different ways of using it. Thank you very much. This girl says, I feel even with epilepsy, I can do anything I want. It doesn't get in the way at all. I can do anything I want to do.